Okay, here we go.
Hey everyone, we're just about to get started. Okay, oop, I see you. Here we go. Hey Catherine, thanks for joining us. Oh, they did this new thing. Okay, there we go. I was like, all these updates with Instagram.
I'm like, did we do it?
Okay, I see you perfectly.
Okay, great. And there's no delay. We're in both places.
Yes, I love this angle with the plants. It's just giving light. Yes, I love it.
I had to, during the pandemic, I was like, this needs to be a place I want to be.
Yes, no, I love it. I love it. And we got some gorgeous doc in the back.
Yes, always, always, always. This is actually my first journal. I mean, it's like beat up now and it's all used, but this is my first one. And I kept all my little ideas and stuff in here, so I keep it.
Oh, I love it. Love it. You guys get your gorgeous doc merch and resources, everything. So thank you guys for tuning in today. Happy Friday Eve. I'm sure that everyone is ready for the weekend. So my name is Jalen. I am the She Sexual Health and Everything campaign ambassador. Our mission for sexual health everything is basically to create a safe space for conversations, to have conversations around sex, and reduce the stigma surrounding HIV, STIs, and just join the conversation about sex, because we know that it's a big issue here in the DMV. We have a familiar
the country,
the world, everywhere. And we know outside is about to open up. So we wanted to debunk some myths so you guys can be prepared this for the summer, because we know that everyone's going to be outside, and we know when we are outside, everyone's opening up. We're opening up a lot of things. So we want to make sure that we're safe. We're safe and we're educated and we're prepared, so we can do that and have fun and experience pleasure. So we have Dr. Ramsey back again. She was with us.
Hi, everybody.
Yes, we have her here today. She was with us last month. If you haven't seen the STI live that we did, please check that back. We had a talk about STIs, and she is an adolescent physician here in the DMV. So we are going to get into some myths, because there's a lot of myths concerning sexual health, reproduction, STI medication. So we just want to get into that. And also we want to see what you guys think. So are there any myths that you may have that you want to know if that's true? Please, communicate with us here in the comment section. This is not for us to just be talking to ourselves. We want you guys to be educated, and we want you guys to learn. So thank you guys for everybody who's joining in. And we can just go ahead and get started. Oh, there's a lot of people joining in now. Hey, y'all. Hey.
Hey, y'all.
So it won't take too much of your Friday Eve, because I know you're getting ready for Friday, so you can be out for the weekend. So we just want to get right into it. So the way we're going to do this, we're going to split this up into a couple sections. We have reproduction, STIs, PrEP, and just some additional questions that we got from the audience previously throughout the week. We asked you guys, send us your questions and we will answer them anonymously. So we're going to start off with reproduction. So first I want to ask you, Dr. Ramsey, can only get pregnant while ovulating? So is that a myth or a fact?
Ooh, that is a myth. It's technically true, but it's also a myth. Okay. So the reason why I say that is because the way that pregnancy works is that you ovulate. Mm-hmm. Actually, I'm gonna show y'all a picture. I'm very visual. If you explain something to me, it won't stick. So I need pictures. So I'm gonna just show you, because I think that's the best way to explain it. I have my little printouts.
We love that.
So this is the menstrual cycle. Mm-hmm. And what normally happens, I hope everybody can see this, and I'm sorry, there's like a little bit of a glare, but pretty much what happens is your brain releases hormones. Those hormones communicate with your ovaries. It tells your ovaries what to do. And then your ovaries release hormones, estrogen and progesterone, which tell your uterus lining to build up. And then when there's no pregnancy, then it sheds. So that's how the menstrual cycle normally works. So what happens is this is when ovulation happens. There's a spike in this hormone from the brain. It tells the ovary to ovulate. And then at the same time, the uterus lining is building up, getting ready for that egg to implant. So that's how the menstrual cycle normally works.
Okay.
Now, in teenagers, this communication between the brain, the ovaries, and the uterus is not up to par. It's still trying to figure it out. And so what happens is that sometimes adolescents can start to develop like this follicle, but they never ovulate. Period, but they didn't ovulate. So it can be very complicated.
Okay.
So it's unpredictable in young people, particularly people who are about 3 years out when they first started their period. So say you started your period at age 12, up to age 15, you can expect for your periods to be irregular, and you can expect that your ovulation is not predictable. And older women or older menstruators, you can almost guarantee that every 14 days, the 14th day of your cycle, you're going to ovulate. And so you can kind of predict it. And also there's some changes that happen to your cervix, like fluid that comes out. Sometimes people have like kind of stringy discharge. That's because in the cervix is thinning out. So that's another sign of ovulation. The other thing that happens is your body temperature changes. So your body temperature actually goes up. And so that's also another sign that you're ovulating. So some people use those methods to kind of help with planning for pregnancy. So if they're trying to get pregnant, they check their cervical or their vaginal fluid, they check their temperature, all those little signs that your body tells you that you're ovulating. But in young people, it is not predictable. And so you can't necessarily correlate ovulation, periods, sex, pregnancy all together, which is why I always tell my young people use a condom, because everyone should, but definitely when you're in the first couple of years of your period, it's just unpredictable and you don't know if you're ovulating or not.
And speaking of it, just a small plug, if you need some condoms, we have our Sneaky Link packs in our bio, which are free. They will come right to your house in an undisclosed box like Amazon, so no one would know ever what it is. So if you ever need that and just want to see what are the options out there for protection, you can just order one and it's free. So we have magnums in there, we got some B condoms, which are Black owned, we got Dental Dam and an internal condom, and just a whole bunch of resources there. So yeah. So the next one is, okay, so that kind of correlates with this next question. So we talked about how you can get pregnant while ovulating, but then you can't get pregnant when you're on your period.
So there we go again. That's another thing we're talking about. So with young people, once again, you can't tell when you're ovulating or not. So there can be times where you have a period, and right after your period or during your period, your ovary is like, actually, I feel like releasing an egg right now, and it just releases an egg. So it's unpredictable. If you can't like, in someone whose menstrual cycle is mature, they can see the first day of my period, the last day of my period is the beginning of my next cycle. 14 days from that, I'm probably going to ovulate. And then a couple of days from that, or 2 weeks from then I'm probably going to have my next period. Like they can predict kind of what is going to happen with their cycles. And young people, you can't predict it. So you could be bleeding, ovulating at the same time. So that's why we always say you actually can still get pregnant if you are on your period. The other thing is some people do have a little bit of bleeding and spotting when the egg and the sperm together implant inside the uterus. And so you can have a little bit of spotting with that. So just because you have bleeding or spotting doesn't mean that you're not at risk or currently pregnant.
Okay. That's good to know. So you can get pregnant while you're on your period. As when everyone know that. Okay. So
it's very unlikely, but it can definitely happen, especially if your body is still immature. Your communication between your ovaries and your brain is immature. The other thing I will say is the egg and the sperm both have a certain half-life. So the egg can survive up to like, I think 3 days, and sperm as well. So depending on how everything is timed out, like you could still, even if you had sex 3 days ago, if your egg just happened to release at the time where the sperm was still there, they could still get in contact and you can still get pregnant. So
sperm can just be hanging out and just, lollygag its way to the egg.
Yep.
Being pregnant.
Yep. Exactly. So.
Wow. So that's great to know. So now we know what kind of resources we can use to prevent, pregnancy and STIs. But we also want to know about our vaginal health. So we want to know, is douching with water just fine? Because I hear that a lot. I listen to a couple podcasts, sex-related podcasts, and a lot of people say, "Oh, I just take the solution out, and I just put the water in there, and I just douche." So I want to know if that's fine.
Yeah, that's a great question. So actually, that is actually not terrible. It's safe.
Okay.
Some people, everyone's a little bit different. Some people will clean so the vulva is the outside of the vagina, of the reproductive tract, and then the vagina is the like canal that goes inside the tract. So let's just make sure we're using the right terms, because I'll have people tell me their vagina, but they're talking about their vulva. So vulva is the outside, and that includes the outer lips, the inner lips, the clitoris, everything that's on the outside, and then the vagina is the inside, and where the uterus and the ovaries and everything is. So if you some people will just clean the vulva with water. Some people use a very mild soap. Anything that's really harsh, and when I say harsh, I mean like it smells like roses and clementines and cotton candy. All that stuff is not good for the area down there. It doesn't want all of that. Just keep water is fine. If you are using if you're inserting water into the vagina,
okay.
If you are inserting anything else into the vagina, that is not fine. Because the vagina is full of bacteria. It's full of organisms that naturally live in the vagina, and they're all in perfect harmony. So anytime you introduce anything into the vagina that isn't normally supposed to be there, it can throw everything off. So using water is fine, but using anything that's mixed with the water, vinegar, all these like yoni, steam flour, whatever, that's just a no. Just don't do it. Yoni beads, whatever, yoni, whatever. Just don't leave it alone. Just leave it alone, because it's a very sensitive area, and the more stuff you put down there, the more complicated and the more irritated it can become. So I say, if you want to douche using water, that is okay. But anything else, no. And if you're douching with water, why? Are you concerned because it smells different? Are you concerned because your discharge is irregular? What is the purpose? Because your body functions on its own. It does not need you to do that. So if you are worried that something is imbalanced and you're using the water to try and balance it or clean it, then you should go see your doctor or your healthcare provider, because you might be having some symptoms that are consistent with something else. So I don't know if I answered the question, but
no, that was great.
No, whatever.
Someone said, and that's on period. Love that comment. So yeah, we should be putting anything up there. And yeah, I love that you mentioned like, what's the why? Why are we douching with water? What is the need to do that? So if you feel that there's a need, maybe we need to take another look, and maybe we need to go see a provider. So I love that. So I love your artwork, and I just always say that, but I just you did you had some promo out earlier this week with menstruation and just periods in general and just how it works. And I love that you were inclusive with that. A lot of times when I think about my childhood and everyone else's childhood, especially when you're getting ready for gym and things like that, and there's no privacy. I mean, there's very little privacy. A lot of times people may look, and that's fine. Yes. And even when people are even porn surfing, they think that everything is supposed to be perfect. So I want to know, does everyone's vagina looks the same? That was one of the myths that were submitted.
Yes, that's a great question. The answer is absolutely not. Everybody's vagina and vulva is completely different. Even your uterus can be completely different. I've had patients whose uterus was something we call retroverted, which means that instead of it leaning forward, it leans backwards. And that's a normal variant. So everybody's body is different. I can't tell you how many patients I have seen in my clinic because they thought that there was something wrong with their vagina or their vulva. They're like, there's something, my lips, there's something wrong with it. One is bigger than the other, or something, it doesn't look like the TV. Like, I don't know what's wrong. Is it going to prevent me from having children in the future? Do I need surgery? And the answer is absolutely not. Absolutely not. There's definitely variation in the labia minora, the labia majora. I have another diagram. I like diagrams. Do I have that one? I don't know if I do. Of course, I don't have that one printed, but there's all types of variation. Mm-hmm. No, I don't. I have it on my iPad though, because I stay ready.
Oh yes, I know that's right.
I stay ready. So yeah, there's all different types of variation. And the same thing for males too. There's all different types of variation. So different sizes of the penis, different like angles that the penis turns, different lengths, different thickness or width, like different. Some people are circumcised, some people aren't. There's lots and lots of variation. So this is the vulva, and then the hole in the middle is the vagina. And then it's hard for me to like hold it and instruct you guys at the same time. But there's 3 separate holes, which is something that is very confusing to a lot of people, because I'll have people say like, oh, when I put in a tampon, like, how am I going to pee? It's 3 different holes. So there's the urethra at the top, there's a vagina, and then there's anus. So they're completely separate. So the hole that you pee from and the hole that you menstruate from are completely different. But there's definitely variation. There can be variation in the outer lip, the labia majora. There can be variation in the inner lip called the labia minora. There's some people whose labia minora is bigger than their labia majora, and it kind of hangs down or dangles down, and that is a completely normal variant. And actually, I don't know if you've heard of Sarah Bartman. I don't know if anybody in the audience has heard of Sarah Bartman, but this was like back a long time ago. I think this was during the times of slavery. And she had like she was from South Africa. She was from a tribe in South Africa and had a really large like derriere, but she had vaginal lips that were very long and kind of hung and dangled down. And of course they like, all the doctors and scientists, they like observed, they like, examined her, and they like prodded and probed at her, and they studied her, and they made all these assumptions about, oh, these lips mean that she's more sexually, hypersexual and blah, blah, blah. I made all these terrible assumptions. And when she died, they took her body and they put it in a museum in France. I mean, it was just horrendous what happened to her. But that's the reason why now people are like, oh, it's normal, because for so long, people had been told that their body was abnormal and that it was an anomaly and that it needed to be studied and that it was like something that, wasn't typical for like women, and that there was something wrong with you because your vaginal lips were bigger or whatever. So that's where a lot of that stigma actually comes from. And the other thing too is the world of gynecology was mostly men. And I don't know if you guys have been like keeping up with this movement, but the clitoris is something that nobody knew what it looked like until like 10 years ago. Yeah. I didn't even learn about it in med school. I learned about the structure, but everything else that's underneath, and underneath the labia and underneath the labia minora and majora, right. I learned about that in medical school or in sex ed class or anywhere. So if some people have had surgery to their labia minora or their majora and actually have damaged the clitoris and the inner to the clitoris because it's right underneath all of those structures. It's important for us to recognize that your labia and your vulva is yours, and it is what it is. You don't need to have surgery on it. It is beautiful just the way it is, and it is nothing wrong with it. It is a completely normal variant. I'm done. Off my soapbox.
No, I know. I love that because I was actually attending the SLAM conference earlier, and they were talking about.
Oh my God, I love the SLAM conference.
And they were talking about the history. In one of the sessions, they talked about the history of the clitoris and just, pleasure in itself. So I think it's just so interesting, and I think it's really important that we as clitoris holders know how it works and just how to experience pleasure and know that we're all different, and that's okay, because a lot of we see so much in the media of what is quote unquote normal.
Exactly.
And we have to understand and embrace our own normal. So I think
that's exactly why I go so hard with Gorgeous Talk, because when I was a kid, I couldn't find anything that looked like me. When I was in medical school, I didn't see anything that looked like me. Now, as a physician taking care of teenagers, I can't find anything that looks like them. And that's not okay, because then they're taught, okay, that's normal and I'm other. And that's not okay. That's not okay. Like, everyone deserves to see images that represent what they look like and that they can relate to. So it's something that is like a personal mission of mine, and I'm gonna keep going until everyone sees something that looks like them.
Please, we appreciate it, and that's right. I still haven't seen it. I'm like, we in 2021, and it's still not available. So
exactly, I'm like, come on now.
Yeah. So now I really want to get into STIs. Oh, anonymous submission. Okay, so using coconut oil or all natural lube is better for your body than regular lube.
I would say no. It depends, because what does like all natural mean, right? Just because something is, this is the trick that we get into, and that the industry tries to trick us into. Natural does not mean better. Natural does not mean safe or healthy or good for whatever body part that you're going to use it for. So I normally recommend water-based lubricant. You don't have to worry about the condom being irritated or thinning out or ripping because of the lubricant. Coconut oil for some people can be very, very irritating. So I wouldn't recommend it unless you know, like, for your body that it works. But I would say water-based lubricant that has been tested and tried and true is probably your best option. Anything that's oil-based can actually break down the latex in the condom and can make it less effective. So I wouldn't use anything oil-based. I wouldn't use like olive oil or butter, or like any Crisco, whatever people are using these days. I wouldn't use any of that. So they probably have some lubes that are water-based but have a better impact on the environment. I don't know any off the top of my head, but I would say to just do your research and find a lube product that you trust. I know there's someone on Instagram. I think her name is Literally the Best, and I think she actually started her own lubrication line. So I would check her out. I haven't like seen it or like recommended other people use it, but I do know that she started a line of lubrication.
Yes, and if you want to try some lube, another plug, we do have some in the Safe Sex Kit. So we have some flavored lube, some water-based lube, and silicone lube. So you definitely can use some of those resources that we have. But yeah, I also, as a sex educator, I don't recommend anything oil-based as well. It can be very irritating. Yeah. Like Dr. Ramsey just mentioned.
We have a few comments in the chat.
Oh. Yes. Porn will have you thinking.
Yes. Hey, BB. That's my girl. She always supports me, you guys.
Yes.
Day one.
We appreciate it, because no, that is true. Like, porn will have you, just to go back to the body image thing, like, porn will have you thinking your body is abnormal, that your pleasure is abnormal because you're not experiencing pleasure the same way that they are, or reacting to it in the same way. So I think it's just really important that you explore that on your own, versus,
I mean, pleasure has not been taught in sex ed. Sex ed has been created in a way where it's like, don't get pregnant and don't get an STD, and like that's it. It hasn't been taught in a way that's empowering. It hasn't been taught in a way of, how do you communicate with your partner? How do you ask for consent? How do you tell somebody you like something or you don't like something? How do you, like, that kind of stuff is never included in sex ed. Now we're moving towards that, and everyone is, I think the sex ed community is woke now and is like, you know what, like, I guess we kind of do need to talk about those things.
Yeah.
And now we know that what the clitoris is, and that it exists, and that it's this huge structure, because before we were told it's like this little thing just at the top, and it's like, no, it's like this huge structure that's in there. So there's so much more there is to learn, and it's important to like explore your own body, look and make sure everything is normal for you. And if something changes, then and that's when you need to seek medical care. But, unfortunately, a lot of people get their information from porn and from TV, and it's not always accurate. So,
yeah. Exactly. And someone said, not Crisco. Yeah, I mean, have you guys seen, what is that movie? movie Booty Call. Look, I seen a lot of things used in that movie.
Yes.
And,
or what's the other movie? Don't Be a Menace.
Oh, yeah.
Drinking your juice in the hood or whatever. They were all in the fridge. They used all the ingredients.
Please don't use any cooking supplies in the bedroom. We just want to say that.
Well, there's some you could use, but just not on the vagina.
Yeah, just don't put it down. Yeah, just don't put it.
Yeah, just not on the vagina. Yeah.
I was like, yeah, you can use some things, but yeah. So now I want to get into STIs, because a lot of times when we have to do a lot of work with STIs in general. Yes. And just because it has a lot of stigma associated with it, so we're gonna get into STIs. So first I want to ask you, you cannot get an STI from oral, because a lot of times when people are having sex, they want to just, they'll put the condom on for insertive sex, or penetrative sex, but then for oral, we're not putting any condoms on. So I kind of want to talk about that.
Yes. I tell everybody all the time, if you have any contact with there's 4 different things: mouth, anus, vagina, penis. With anybody else's anus, mouth, penis, vagina, you can get an STI. So any combination of those things. And a lot of times people will be like, the other thing is sex educators, doctors, other healthcare providers will be like, oh, are you gay? Are you straight? Are you this? Are you that? I don't care how you identify. What I care about is which of these things are having contact with which of these things. That's the thing that is most important, because then that tells me what I need to test and what you're at risk for. Definitely, you can get an STI from oral sex. We see it all the time. The other thing I will say is that plays into this concept of virginity. A lot of times people are like, oh, first of all, virginity is a social construct, because everyone's definition of sex is different. And some people will be like, well, vaginal sex where the penis goes in the vagina, that's only sex that counts. Oral sex or anal sex doesn't count. I'm still a virgin because I didn't have vaginal sex. No, you can still get an STI. So that's why virginity is a social construct. I will tell you, I have definitely seen patients with gonorrhea, chlamydia in their oral pharynx, in their mouth. It happens. And some people may have no symptoms. And some people may just have a little bit of sore throat, a little bit of discomfort, but it is definitely possible to get an STI from oral sex. So you have to use a condom from the beginning to the end. I always ask my patients, they'll be like, oh yeah, I use a condom. I'm like, the whole time? And they'd be like, well, the first time, but the second time we didn't. I'm like, all right, so then we're going to test you for everything. Because you can still get an STI. All it takes, it doesn't even, sometimes people will say, oh, well, he just put the tip in. He didn't ejaculate, or he didn't come. I didn't come, he didn't come. He just put it in and he just moved it around a little bit. You can still get an STI. Any contact. Any contact. If you're not sure, just come to the clinic, get tested, we'll sort it all out. That's it. And that's why I always ask my patients, which parts of your body did you use? Because if I test your urine for gonorrhea and chlamydia and trichomonas, I'm going to find the infection that's in your throat. So if you're having oral sex, if you're having vaginal sex, you need to let your healthcare provider know, because they need to swab and test that specific area. So it's very important to be honest with your doctor or your healthcare provider. I know sometimes people can be judgmental, but you got to do what you got to do. You have to tell them the truth. You have to tell us the truth. People tell me the truth most of the time, I think. But even if you think that they're going to judge you, reproductive health care is confidential for teens. And so they cannot tell your parents. They are not allowed to tell your parents. It is confidential. So tell them the truth. Tell them exactly which body parts you use, and what you did, how you did it. Tell them the truth so that they can test.
Absolutely. Wait, gonorrhea in the throat? Well, I didn't know that at my big age. And again, it's a lot of things that I went to Catholic school, so they definitely didn't teach this. So it's good to relearn some of these things, because a lot of times we just think, or we just go off of what family members or someone else told, or friends told us.
Friends, exactly.
Yeah, and I know that was a thing. Like, when I was in high school, people were just like, "Oh yeah, using condom for penetrative," but they weren't using condoms for oral sex. And
right, because it doesn't count. It doesn't count because you're still a virgin.
Yeah. So I kind of want to piggyback off on that question. So will we say oral sex is a low risk for a STI?
I wouldn't say it's low risk. It's still a mucous membrane with a whole nother mucous membrane. I wouldn't say it's low risk at all. You could definitely get herpes. You can 100% get herpes from oral sex. So I would definitely not call it low risk. And the other thing, I've had people say, "Oh, I have this one young person that I was like working with when I was doing sex education in high schools, and she was like, I don't even have sex with the lights on. I just have sex with the lights off. I don't even look down there." I was like, so one of the other teens in the group was like, "Girl, you need to look down there." She was like, "What if there's something wrong or there's a bump or a lump or something?" She's like, "You need to look." So that's another thing. Make sure you get a good look. I know people want it to be romantic. They got the lights down, everything all set. Take a look. Make sure. And that's why it's important you look at your own body so you know what's normal for you. And when you see something abnormal, you come to the attention of your healthcare provider and we can test it and make sure everything is fine. But definitely take a look.
Yeah, take a look, guys. And also, that's another way that you can introduce a conversation with your partner. Like, if you guys are knowing that you're going to have sex, let's have a conversation like, okay, well, we know we're about to have sex. Let's go get tested, before.
Yep. Or when was the last time you got tested? What were the results? That's a conversation that you should definitely, That's right. Take it to the next step. And when the pandemic first hit, everybody was like, "Did you get tested for COVID? What is your result?" "Oh, I'm not coming." You get tested.
Now you got the vaccine. So
right. But like, you still need to keep that same diligence, keep that same energy. That energy you had when you was worried about COVID, keep that energy towards STIs. Same thing.
Kat Adulton said, "Let me see the results." Yes, I need to see the receipts. That's what I call them. I need to see the facts. So we had a couple of anonymous questions.
Sure.
So how do you have oral sex with a condom on without it tasting like latex in your mouth? What if you are allergic to latex?
Yeah, that's a good question. So, there's definitely different flavors. There's different flavors of condoms. It depends also on what kind of oral sex. If you're doing oral sex on a penis, there are flavored condoms. There's also for vaginal, like oral sex. There's dental dams. Some people will use saran wrap. So they'll cut saran wrap and use saran wrap or they'll cut a oral condom into like a kind of like a flap and use that. But there's really no other way to kind of, I don't know if there's, I'm not up to date on that. I don't know if there's any other types of oral condoms that aren't latex. I know that for like vaginal penetrative sex or anal sex, there are like polyurethane condoms, which are not latex. So for people with latex allergies, but I don't know if they actually make oral polyurethane condoms, like for oral sex. So, the important thing is if you are the type of person that's like, I don't want to use a condom, then that has to be a conversation with you and your partner. And if you're both tested and you trust each other, then you may not need to use a condom. But if it's somebody who you don't know, you don't have that relationship where you could say, you got tested, I got tested, we're all on the same page, then you need to protect yourself. So unfortunately, I don't know if that answered. I'm sorry, whoever that is.
No, that was perfect. And I was actually
wanted to hear.
I know. No, that was perfect. And actually, I was going to get out one of our dental dams that we have because this is actually spearmint flavor, but you were mentioning using this around the shaft of the penis, and you can do that. Or we also have the flavored condoms, but this is a flavored lube, but it's the same brand, and they sell the flavored condoms. But the latex-free flavored condoms, I haven't seen those just yet. So somebody has.
Yeah, I haven't seen them either, but you might be able to corner whoever it is. You might be able to corner the market. Go ahead and make it.
Absolutely. So next we have, so only men can, so this is another one. We already answered the baby oil question. Well, the coconut oil, so that kind of goes hand in hand. But I want to get into STIs for anal sex, because a lot of times we know that, we talk about oral sex and we just talk about penetrative sex when it comes to women, but we don't talk about anal sex. So I want to know, can only men get STIs from anal sex?
Yes. So once again, these body parts, any combination of these body parts or any other combination of these body parts, regardless of who it's attached to or who it's on, you could get an STI. So if you are a transgender individual and you are inserting your penis into someone else's anus, regardless of how you identify, you can still get an STI. Or if you are any contact between the penis and the anus, you can definitely get an STI. You can also get an STI from toys. I don't know if people know this, but you can get an STI from toys. So sometimes people will think like, oh, I'm using a toy, I'm sharing a toy with my partner or with the person that I'm having intercourse with. I don't, have to worry about an STI. You can still get an STI. It can still be passed through the toy. So that's why it's important to clean the toys, to use condoms when you use it. And once again, have that conversation with your partner. Are you tested? Did you get tested? When was the last time? I got tested a couple weeks ago. My stuff was good. Is your stuff good? Are we all good? So that we can move forward. But definitely you can get an STI from anal sex, if regardless of what your gender is. Your gender does not matter. You can still get an STI from anal sex. And the tissue in the rectum is actually thinner and is actually more prone to ripping and can increase your risk of STIs. So it's important that you use condoms when engaging in anal sex, and also lubrication. A lot of people are afraid of lubrication. They're like, oh, if I use lubrication, that means that like my body wasn't like able to like get aroused on its own. No, you have to use the lubrication. Just use it. Don't like stick to that stigma and put yourself at risk of getting hurt or being uncomfortable. Use it. Just use the lubrication. That's why it's there. That's why people invented it.
And I just want to like highlight that too, because a lot of times we look at the media, and that's why I really want people to understand what they're seeking in as far as knowledge, because we hear songs like WAP and everybody wants to WAP, and that's fine. And that's fine. Sometimes it may not be a WAP. It may not be that way, and it's okay to use lube.
Right.
Like, you want your sex to be pleasurable, and the more lube or the more wetness, the better. So it's important that we, when we get that information, we kind of take it in like, okay, this is just for entertainment. And,
exactly.
This is not always the case. And it's fine, because our bodies are our bodies.
Yep.
Someone asked in the comments, are silicone toys good?
Yeah, silicone toys are safe. But once again, you want to make sure you clean them in between acts. So using like a mild soap, water, letting it dry out. But silicone toys are safe. So it's best to buy toys from like a trusted like sex toy shop or somewhere that specializes in those kind of things. There's many different types of toys and many different materials that they're made of. There was a good post I saw recently. I can't remember who posted it, but just do your research ahead of time. Don't like just stick anything in your orifice. Because some things are actually prone to holding on to bacteria, or can cause irritation or changes in your vaginal discharge or flora or whatever. So it's better to just do your research ahead of time, find the materials that are safe and are not going to be prone to bacteria. Make sure that you clean your toys in between. Use condoms if you're with a partner, or if you're with someone you trust, make sure that you both have gotten tested and you have that conversation up front.
Yes, and we have a follow-up question about how to clean them. So they ask, is boiling them okay?
Yes, you can also boil. You can also boil them.
Okay, so we're back in the kitchen.
I know, we circle back right back to the kitchen. And guys, by the way, Joshua, he is a real estate agent in New York. So if anybody is looking for real estate, that's your guy.
Oh, awesome.
Yes.
And I just also wanted to highlight while we're on the topic of toys. We had Heart's Desires, Shawnee Hart with us, and she has 2 stores in the DMV area, which are open, one in Temple Hills and then one that is in Adams Morgan. So if you want to just explore what toys are available and what may work for you, you can always go to those stores here in the DMV, just to kind of plug that in if you want a local resource. So next I want to get into, it's kind of like a vaginal health, but it's still on STIs because we were talking about Yanni themes. And I know with Yanni themes, a lot of other things are popular, such as vajacials and waxing. And there's so many now European wax centers, by the way. I wanted to know, is it important to wax or shave because hair can increase the risk of STIs?
Yes, that's a great question. So actually, hair can be protective. There's lots of research that shows that hair is actually protective and protecting the vulva and that area. As a physician, I don't recommend waxing, vajacialing, steaming, all of that stuff because all it does is just causes irritation. The best thing that you can do if you want to remove hair in that area is to trim. So you use scissors or you use like some type of close shaver or something and you just trim the hair because waxing and ripping the hair from the root and doing like those steams and all those other things can actually cause lots of inflammation to the vulva area and can cause irritation there. So I normally recommend not being aggressive and doing all those things. And like we had talked about earlier, all that like cotton candy flavored, strawberries, shortcake, blah, blah, blah. Avoid that. So just a gentle, regular slope. Get you some Dove or some whatever soap of your choice. But anything that's like scented, any of those steams, those flowers, all those things can be very, very irritating to the vaginal area. So I normally don't recommend any of those things. I normally recommend just trimming with scissors. There's a really good article on this website called the Young Women's Health, youngwomenshealth.org. And I use that website for every single thing. I print out one copy, at least one copy a day to my patients. But it's written by healthcare providers and sex educators in Boston. And it's written at the level that young people can understand. So it is very user and reader friendly. And they have an article on hair removal that's really, really good. So, and if you do choose to shave or to wax or any of those like really aggressive things to the hair and on your vulva, you should be sure to exfoliate first so that the hair is very thin. You kind of get rid of all the dirt that's in the area that may be trapped on your skin. You get rid of some of that bacteria that may be on your skin. And then after you remove the hair using an antibiotic ointment like mupirocin or bacitracin or something that can prevent the bacteria from getting into any of the cuts that you may have caused by doing that removal of hair. So those are just some of the things that I recommend for people who are like, I'm a wax anyway. I don't care what you said. So those are just a few things that you could try. But really, ultimately, you just be careful. There's so many things out there and they just cause so much irritation. And I can't tell you how many people I have come to the clinic and everything down there is just irritated. I have one girl, she used Nair. She Nair down there, but she used the like regular Nair. And it was like the Nair that you put on your legs, not the Nair that you use in the more sensitive areas. And she was like, my vagina and vulva was on fire. She was like, I couldn't sit down. It was just so painful. So just please be careful.
Oh, and even when we say that, I know some people are like, it's summertime. I'm still going to do this. At least wait 1 to 2 days afterwards, just because of that, that rippage still there. It can be irritated. Things can be open. Cuts can be open. So I would just say even to just maybe wait 1 to 2 days.
And some people do laser. They do laser, just have it removed altogether. And laser can be expensive. You have to do multiple treatments. But some people, they're like, I just want to be done with it. And they just do laser. So that's also an option. And you can also, make an appointment with your gynecologist or your dermatologist. And they may also be able to help you come up with a plan. But Once again, it's all about normalizing things that are normal. We see on porn and on TV that people have this little landing strip or they have nothing. And that's them. You do you.
Yeah. Yeah. So, yeah. I was going to highlight that too. Yeah. So just know that body hair is okay and it's healthy and it's supposed to be there because it's protecting us. So that's all I want to kind of put out there. So now I want to get into PrEP because we see so many commercials.
I love talking about PrEP.
And PrEP is not really geared towards cisgender women. So with our PrEP myths, I want to ask, one, do you need to use a condom while you're on PrEP?
That's a great question. So PrEP is pre-exposure prophylaxis, and it is a medication. It's a pill that you take every day to prevent HIV. So it has antiviral medication in it, and it's similar to the medication that you would take if you were on HIV, but you would have to take additional medications as well. So it's very similar to the regimen that people who have HIV would take. And the whole concept behind it is that you're taking a medication so that if you are exposed to HIV, then you have a decreased risk of HIV staying in your body and converting into you having HIV disease. If that makes sense. So it pretty much it's like almost like you have an army ready for just in case the intruder comes in, and it just shuts it down and kicks it out, and so you don't have to worry about contracting HIV. Now, PrEP protects you from HIV, which means everything else is fair game. Chlamydia, gonorrhea, syphilis, trichomonas, herpes, HPV, all of that you can still get. You can still get it. The good thing is for many of those other STDs, there is treatment. So for syphilis, there's treatment. You can get a shot. For gonorrhea, there's also treatment. It also requires a shot. For chlamydia, there's treatment. You have to take pills by mouth. Trichomonas, there's treatment that you would take by mouth. HPV, there is no cure for HPV. HPV is human papillomavirus, but there is a vaccine that you can take called the Gardasil vaccine, which we actually start offering at age 9 to 11, and that can prevent your body from once again, it's like having an army ready for if your body is exposed to HPV, it will shut that down and it won't live in your body and turn into an infection. HPV can cause genital warts as well as cervical cancer. So that's why it's a super important vaccine to get. And I recommend it for every single one of my patients. A lot of times parents are like, oh, I don't want to do it because she's not having sex or he's not having sex. But the point is you have to get the vaccine before you are exposed. So that is the reason why we give it so early. People will be like, oh, but a 9-year-old isn't having sex. 9-year-olds, I have 9-year-olds who have had their period. I have had 11-year-olds who have had their period. We have seen 11-year-old pregnant teens or children. It happens. Once you have a period, you can get pregnant. So that's a whole nother thing. But you have to still use condoms if you're on PrEP if you want to protect against those other STIs. The best thing, though, is HIV is the most serious of those infections. And so by being on PrEP, you are protecting yourself from HIV, which at this point, we do not have a cure for. So that is one of the best things that someone can do for themselves is start PrEP. The criteria for who should be on PrEP is very broad. And I offer it to everybody. If you want to be on PrEP, I'm going to write you for PrEP. I'm not going to be like, oh, but you're not like a man who has sex with men and like blah, blah, blah. That's not what the guidelines say, but that's what people think. They think, oh, this is only for a specific group. But in the DMV, women are still contracting HIV at high rates. Black women. So Black women also should be on PrEP. The guidelines say if you have had an STI in the past 6 months, you are eligible for PrEP. That's the whole DMV. So everyone is eligible. So I try to at least bring up the topic and say, like, have you heard of PrEP? This is what it is. Take a look, read about it, let me know. And it's as simple as almost taking a vitamin every day. You just take it before you brush your teeth, whatever you have to do to remember to take it, you do that. And the good thing about PrEP as well is if you forget to take it, say you don't take it for like 2 or 3 days or something, you are still protected. It's not like birth control where it doesn't work as effectively if you don't take it every single day at the same time. PrEP can still be effective if you miss a couple of days.
Okay.
So that's another important point about PrEP.
That's great to know. And I just want to plug too, if you're interested and want to and need or want to learn more about PrEP or need PrEP, we do offer that at Hearts and Hands. So you can just send us a message afterwards or go to our website and we can direct you to access to PrEP.
Yeah, and PrEP is also available at the Department of Health in DC. You can go to the Department of Health. They will physically hand you PrEP to start that day, and then they will help you. They have a coordinator who will help you get connected to getting PrEP. And for some people, PrEP can be expensive. The insurance companies for a while did not want to cover it, but now there's generic forms and they will cover the generics. And the companies that make PrEP actually have coupons to help with the coverage for PrEP. Don't let that deter you. If you really want to start PrEP, like there is a way we can work it out.
Yes, I love it. So the first question that we had in the comments, someone asked, "What is trick? I'm old. What's trichomoniasis?"
Yeah. So you guys know I love to draw, so I drew like a little diagram of what it looks like. So this is what trichomonas kind of looks like under the microscope.
A little tadpole.
So trichomonas, yeah. So trichomonas is actually not a bacteria. This is me nerding out. It is a protozoa. So it's different than a bacteria, but it's similar. And it has this little flagella, this little tail, and it just kind of whips around. So when we look at it on the microscope, we can actually see it doing like this little squiggly thing. The problem with trichomonas is that it can be very, very irritating. And so in the doctor world, we call it a strawberry cervix. So it can actually irritate your cervix to the point that it looks red and like very irritated. And we call it a strawberry cervix. Some people with trichomonas can have no symptoms at all. And males can also have trichomonas and have no symptoms at all. So it's one of those things where I always test for it just in case. Because you can have it and not even know you have it. Some people have had it for a year, 2 years, no symptoms, and nobody tested for it, so they didn't know. So trichomonas is definitely, in this area, in the DMV, definitely something that is prevalent. And so when you go to your doctor or your healthcare provider, just ask them, can you also test me for trichomonas? And they can send it from your urine the same way that we send gonorrhea and chlamydia.
Awesome. And then I wanted to ask you as well, while we're on the topics of infections, what can you do to prevent yeast infections?
Oh, that's a good question. Oh man. So yeast naturally lives on our skin. We all have yeast everywhere. And we have yeast on the skin, on the vulva and in the vagina. So yeast, it's just a part of our microbiome of our body. Now, what can happen is there can be an imbalance in the amount of yeast, and it can be so imbalanced that it actually can cause irritation. It can overgrow, and that's when you get a yeast infection. So some of the things that increase your risk for yeast infections are wearing underwear that is too tight, or underwear that is made of, normally cotton is the best because it's very breathable, but wearing underwear that's made of a different type of material that may be a little bit more irritating to your body. The other thing is yeast loves wet, moist environments. So if you go swimming and you keep on your bathing suit for the whole rest of the afternoon, something like that, that can increase your risk of having a yeast infection. And then also exercise, like say you're working out and you're sweating down there and it's very hot and moist and you have on tight underwear that's not breathable, that can also increase your risk of yeast. Other things that increase the risk of yeast can include some systemic issues. So like anything where you have like a immunodeficiency, where the yeast is allowed to overgrow because your like immune system is not able to keep it in check, as well as like diabetes can also increase your risk for yeast infections. So some people will present with diabetes with just yeast, like having like increased yeast infections.
Right.
The other thing that increases your risk of yeast infection is just messing around with down there. You're using the wrong soap, you're using the wrong, products, you're wearing the wrong underwear. So knowing what works for your body and what you're sensitive to and what you're not sensitive to is really important, because any imbalance can just like throw things off and allow the yeast to like overgrow. Some of the symptoms of a yeast infection are that it is very itchy and burning, and it feels like your genitals are on fire. That's what it feels like. And then typically your discharge is very clumpy, so it kind of like looks like cottage cheese and it kind of sticks together. So that's normally how yeast infections present. Now, if you have a smelly odor, if the odor is different, that is not a yeast infection. Yeast infections typically don't have odor. So odor makes me more concerned for something called bacterial vaginosis.
Okay.
Bacterial vaginosis is an imbalance in the bacteria in your vagina. So, like I said, everybody lives in harmony. The yeast and the bacteria all live together in a nice community. Then if you have anything that throws off that balance, like douching, yoni beads, steaming, flowers, glitter, all the stuff that people want to put down there, it kills off the bacteria that's good, that keeps the bad bacteria in check. And that bad bacteria can overgrow. And that bacteria actually can release chemicals that have a really fishy smell. So people with bacterial vaginosis will say that they have a really fishy smelling odor and that their discharge is very, very thin and kind of like watery and kind of gray. So that is more closely related to BV. Both BV and yeast you can get without having sex. So they're not sexually transmitted, but having sex can throw off your pH, and so therefore can increase your risk of having a yeast infection or BV. And you can have both. You could definitely have both. And you can still have an STD. You could still have a sexually transmitted infection. So people be like, oh, I have a yeast infection. I'm like, I'm going to send everything. And then inevitably something comes back and the chlamydia test is also positive because chlamydia throws off your pH. It throws off the bacteria that normally keeps everything balanced. So it's important. If you know that you have a yeast infection, you go to the doctor, go to the clinic and you get or the pharmacy and get an over-counter medication, that's fine. But if you've been sexually active and you haven't been tested, you should definitely go and get tested just to be sure it's not something else.
You guys hear that? Just go ahead and get tested. I am a firm believer. I just don't even believe in going. I mean, I know it's available for us to go and get the monostat, but I just feel like just go ahead and get tested just to see, just to make sure you can double check. So before we close, because I know these are some questions that people really wanted to know. The last question, I guess, that we can ask is, can not having a period while on birth control be harmful to your body?
Oh, that's a great question. Yes. So, pull out my little diagram. So, and guys, all these images are available for download on my website, www.gorgeousdoc.com. And then some of them, like this one, is actually free. And some of the just regular genital pictures are free. I have some that are more body positive, different colors, a little bit more detailed. Those are available for purchase. Okay. And if there's something that you want and like you're like, oh, I wish she had a drawing of, I don't know, whatever, you could always message me and I can work something out and draw it for you. So this is the menstrual cycle again. And I always like to go back to the menstrual cycle and go back to anatomy because that explains everything. So this is the menstrual cycle. And the way that the menstrual cycle works, the brain releases the hormones, LH and FSH. Those hormones stimulate the ovary to then release estrogen and progesterone. And then those hormones communicate with the uterus and tell the uterus to build up a lining to get ready for the egg that's fertilized to implant and to go on to pregnancy. So the whole purpose of the menstrual cycle is to get ready for pregnancy. Now, birth control is, there's different types of birth control, obviously, but most birth control contains estrogen and progesterone or just progesterone. Now, the way that birth control works is that it gives your body a steady dose. So as you can see here, there's like these like ups and downs in the hormone levels. It gives your body a steady dose of these hormones. And then what happens is there's communication, not just from the brain to the ovaries to the uterus, but backwards from the uterus and the ovaries, the ovaries back to the brain. So all of these things are in communication and like kind of like we call it an axis. So they like communicate back and forth, up and down. So when your When these hormone levels are kind of at a steady state, what it does is that it prevents. Am I still on the Instagram? Okay, there we go. My phone decided it wanted to time out. When these hormones are at a steady state, what it does is that it suppresses ovulation. It tells your ovary, like, you know what, you don't need to make any more progesterone or estrogen. I got enough. Like, you're good. Like, just stop. You don't need to do that. And so ovulation doesn't happen, and that's how you don't get pregnant. The other thing that you can't see here is that it also increases the cervical mucus, and the cervix, it like creates a thicker mucus so that you don't have sperm can't get in there. And then what happens is, so I don't know if you guys have seen like a birth control pack, but the last row of the birth control pack has no medication in it. And what happens is that mimics this drop in the hormone levels here. Have a period. So that's what we call a withdrawal bleed. So you're withdrawing the medication and your body senses that those hormone levels have now dropped, and it drops your uterus lining sheds. So estrogen and progesterone kind of work like brick and mortar, or like the mortar is like the stuff in between a brick, and they kind of work together to hold the lining together. So when you don't have either one, it just sheds the lining.
Nice.
So that's how birth control works. So I say all of that to say it is okay to not have a period when you're on your birth control, because you are literally controlling your hormones.
Right.
So it's okay to not have a period when you're on birth control, because we are artificially taking over your menstrual cycle and controlling your hormones. If you don't have a period when you're not on birth control, that is abnormal. That means communication between your hormones from your brain, your hormones in your ovaries and your uterus are not in sync. So people can have periods that come too frequently. They can have periods that are too far apart. They can have periods that are really heavy. All of that is abnormal. And actually, this month for Gorgeous Doc, we're doing Menstruation May. And so I have lots and lots and lots of images about menstruation. If you have more questions about it, you can go to my Instagram and check out some of the pictures and stuff that I put out this month. So yes, no periods when you're not on birth control is abnormal. No periods when you're on birth control is perfectly safe. And actually, we can manipulate your hormones in a way that you have little to no periods, or very less frequent periods.
That's great to know. Okay, so you guys heard Dr. Ramsey. If you want to know any more additional questions, just please message her in the comment section on her Instagram or Facebook. If you want to keep up with Dr. Ramsey, you can follow her at Gorgeous Doc or at www.gorgeousdoc.com for more content, resources about everything. She has her merch in the back. We also have some content resources if you need.
Yes, lots of merch.
Adolescent health, anti-racism, and activism.
I just wanted to do a quick plug also. I'm going to be doing a giveaway for this pouch. So you guys are the first people to find out. So you're lucky joining us today. So this pouch I'm going to be doing a giveaway next week. So just stay tuned, follow me, keep track, because I'm going to be releasing the information and the instructions next week. But it's a nice little pouch, and you can put your pads in there, your tampons, whatever you want. Luxury goods. It's like a vegan leather. It's not real leather, but it's meant to be luxury goods is meant to be kind of sticking it to the man, because tampons and pads in this country are still being taxed as luxury goods, even though they are necessary for menstruators. So this is like a way to be like, look at me with my luxury goods. Then people are gonna be like, what do you mean by that? And then it opens up the dialogue for why tampons and pads should be available for free across the country. So that's my little plug.
No, absolutely. So you guys have the information here. And if you're interested about PrEP or some of the condoms that we mentioned today, please don't hesitate to go to the link in our bio and look for that information. We do have it available for free. So just want to put that out there. Thank you so much, Dr. Ramsey, for today's session. Again, I want to encourage anyone who's listening to join the She community. We have so many perks, which gives you resources from previous sessions that we had, and also some swag. So we will mail you out some swag, which comes with a lot of different things. Don't want to say it because I want you guys to be surprised, but you guys get a t-shirt, of course, and some other resources that are really cool. So just want to put that out there. And we'll see you guys for next month. We have great things in store, so just keep up with the She page. And I want you guys to have a great weekend. Stay safe.
And thanks for all the questions, everyone. I appreciate everyone who participated. It was a great discussion. And if you guys have more questions, like, feel free to reach out. Oh, hey, Dr. Rhodes. Oh, my mentor's in the chat. She never uses Instagram.
Yes, Dr. Ramsey, you rock.
Say hi.
Hey.
All right, bye, everyone.